Report found disproportionate use of acute care utilization by race. 22 News State House reporter Ellen Fleming has the breakdown.
In a report issued last week, data shows that minority patients are more likely to depend on emergency department care, which could point to difficulties accessing primary care. The Center for Health Information Analysis, or CHIA, released this report. The focus of the report was on how different races utilize acute care, which includes inpatient discharges and emergency department visits. Non-Hispanic Black patients had a greater share of inpatient discharges and emergency room visits in relation to their population. Hispanic patients accounted for a lower rate of inpatient visits, but a higher share of emergency room visits relative to their population. And Asian patients had a lower share of inpatient discharges and emergency department visits compared to their population, and also the lowest readmission rates compared to other races and ethnic groups. Lauren Peters, executive director of CHIA, said in a statement, "Barriers to care in the appropriate setting adversely impacts patient outcomes and often results in increased downstream costs to the system. This report reveals key differences in hospital utilization across racial and ethnic groups that warrant further examination and policy intervention as part of our collective efforts to advance health equity in the Commonwealth." The report was made possible by the utilization of case mix data, which includes detailed information on inpatient discharges, emergency department visits, and observation stays. The report looked at data from July 1st, 2020 to June 30th of 2021, which of course overlapped with the COVID-19 pandemic. Working for you at the State House in Boston, Ellen Fleming, 22 News.